But over the past 2 years, I do want to talk about some of the things that we have done, some of the formalized processes. So I'm going to focus on really the bulk of it is building a virtual infrastructure. So as you know, HealthLinks isn't a bricks and mortar operation. It's a philosophy of how we are going to be delivering care. And it's about how do we work better with partners. And I think one of the things that we really have to keep in front and center is the patient has really become a very significant partner in a way that they never have before. And it's about advancing the thinking of doing with the patient. We're great at providers at doing to the patient and for the patient. So this is really a philosophy of change, not only at the patient level, but at provider level. And then, of course, readying for the future. The ministry told us that funding was for 2 years. Our funding is up at the end of March, as far as we know. We haven't heard anything different. So we are now in the process of taking what we have built over the past 2 years and building a sustainability plan to really build capacity across our partner organizations. So when we think about building the virtual infrastructure, of course the business plan was really the core in terms of setting up some of the structures, the working groups, the projects that we were going to be working on. So that document has really guided a lot of our implementation. And then there's the terms of reference. And the terms of reference really have a number of elements to them. So our guiding principles, our accountabilities, the rules of engagement around partners, but also talks about the HealthLink mandate. And that is about how do we break down those silos of care? How do we really build a seamless continuum of care for our patients? So these are our guiding principles that all of our partners agreed to as we were getting going early on 2 years ago. But I do want to just really highlight 3 of them. The one is patient-centered or person-centered. And as providers, that's been kind of the lingo. We're all patient-centered, but what does that really mean? And so I think what we need to do is really challenge our thinking about that the patient is our equal partner. And that to me is being truly patient-centered when the patient's voice is the one who drives the care. We're the experts, absolutely, but the patient's voice needs to drive that care. The second one is sustainability. So we know when the HealthLinks was announced, Minister Matthews at the time certainly indicated that any of the funding for HealthLinks was not for frontline delivery. So our whole work has been to build an infrastructure that supports capacity building within our HealthLink and the partners. So none of our dollars has gone for frontline, but it has gone to help support the thinking and building. How do we do with the existing resources and without adding new resources? And then the third principle I want to highlight is blame-free. So this is a huge system transformation. And any time when there is a big change, there's a lot of angst, and it's very easy to go to the blame game. And so we now, by putting it as part of our guiding principles, we give people permission to call that out. Another part of our infrastructure, of course, is our steering committee. And our steering committee, as we identify other community partners that we need to bring into our fold, our steering committee will grow to represent that. But at this point, the steering committee represents each of the core areas that we are focusing on. And so the steering committee is really the oversight, the governance, making sure that we are complying with our our projects, that our projects are moving forward. But it's also part of the steering committee's role is to actually be the liaison with their sector partners. So the expectation is they become the communication portal for their partners. And the other is project resources. So we've hired a project manager and we have a project coordinator who really oversee the working groups. But I really would like to draw attention. It's been the system partners who are doing the work. And we have had huge commitment. So this is doing off the side of their desk. And as Elgin, as you will find out and are probably already finding out, that's what everyone is doing. This is a commitment to change. And so I did want to just really highlight the work that our partners have done. I'm just going to briefly touch on this. So our whole framework for change has been built on a quality improvement framework. So at the very early stages of our planning, across all of our partner organizations, we identified 15 gaps in care that were happening. Not surprising, a lot of them are the transitions of care, and a lot of them are because we're not communicating, we don't have we continue to work in our silos. So we took those 15 gaps and classified them under the various, so timely access to care, patient and caregiver education. So they became the framework for building our projects and our project working groups. But underneath that are some key enablers or foundational elements that really cross the continuum of that quality improvement framework. The first is cultural change. This is a huge, huge cultural shift, and it needs to be recognized as such. We're asking people to deliver care in a way that is different. We're asking them to break down the silos, and we're asking them to do it with the patient as a partner. Human resources, I alluded that we are not getting money for frontline staff, so it's really about building capacity with existing resources. And then finally, the enabling technologies. And while there is work being done on things such as Clinical Connect and HRM and some of those other, I'm going to, Mike, at this point, our coordinated care planning tool is faxed. But we are working, so we're part of, our HealthLink has been sitting on the provincial working group that is taking the coordinated care plan and building an electronic tool. So we are going to be part of the pilot, probably not till Q2 or Q3, but at least work is coming forward, and it will allow us to share those coordinated care plans in real time with all of the providers that are part of that circle of care. So this is just a list of some of our working groups. All of these working groups are really there to build information resources, provider and patient resources, as well as working on improving access to care. But the real heart of the HealthLink is the Coordinated Care Planning Working Group. And so we also have, within that broader group, we have two subgroups, and one is the ideas team. So we had 4 of our provider partners commit to a very intensive quality improvement work. Ideas is, I know I'm not going to get this acronym. Anyways, it's about driving change. Someone obviously knows what driving change across multiple organizations. So the work that the Ideas Group did was to build a very robust processes around coordinated care planning, but also a lot of tools. So what we can now do, and what we are in the process of doing is rolling this out, is ensuring that we've got a consistent, standardized approach where we're also going to be collecting information on patient outcome and patient and provider experience. The other sub-working group is our patient navigation. So even if we are from healthcare, I'm sure we all still find navigating the system is not easy. So we're building I believe, a very robust patient navigation framework that is really a fluid model, but it's based on relationship. So any research around patient navigation, it's a relationship-based process. So we're in the process of building that, and I will put it out there. Anyone who, any of the other health links, and certainly at the Health Link Leadership Collaborative, anything that we do is people are welcome to. And then I just want to talk briefly about some of our early results. So a lot of the work that the Huron Perth Health Link has been doing has really been building that infrastructure. And so while we don't have a lot of coordinated care plans done to date, certainly that is ramping up, but we are starting to get some early results. And I think the processes we have in place will hopefully, until we can start sharing things in real time, really allow us to ensure that those patients don't fall through the gap.
Mary, could you just tell people what a coordinated care plan is?
Yes.
Like what's in it in
Okay,
layman's terms?
absolutely. Okay, so there's a number of different elements in it. So there is, the patient profile, but also who are the patient's caregivers, both formal and informal. So it's really about getting especially to some of those more informal, like the husband or the neighbor. So it goes through all of that. It goes through all of these social supports that they have in place. So are they on fixed income? Are they, on a retirement income? And so it looks at all of those elements. Then it looks at all of the sort of medical care that they're getting. What are some of the appointments? Who are the people to call for specific things? So there is an action plan component to it, that if this happens, this is who I call. If this happens, so it goes through based on their medical or social issues, actual people that they can call, and of course the care coordinator or the care navigator is always a go-to person for that patient. So I don't know if there's any other questions about the elements of the actual plan. So it is, when it is actually done, as much as that can be filled out in advance of the care conference is done, but most of the work is done right there with the patient present. So, and I'd be happy to answer any other questions around that as well. So some of our early results is we compared both pre and post case conference. Sorry, if I could just grab it. My apologies. So we looked at the patients that we have completed care conferences on, and we're going to be doing this for each one. We looked at their EDUs and unscheduled hospitalizations 6 months prior, and then we're monitoring it on a monthly basis. And early trends are we're seeing decreased utilization. We're also monitoring patient experience, both immediately and post, 2 weeks post-conference. So did they feel respected? But even more so, do they feel confident that they can actually manage their care? Because 2 weeks post, if they're all of a sudden feeling less confident, that's then an issue that we need to get back in there and start working with them. So there is a lot of monitoring that is happening. But I think also monitoring provider experience, because has this been a worthwhile venture for them? And I think some of the case conferences that we're finding is that it's almost like an aha moment in that they now have a relationship with those other staff and those other organizations. So they know if it's about this patient, they can just call that other person. And that's been huge. And I really am a firm believer that while it requires support from above. The real system transformation is going to happen at the front line. And so I think anything we can do to support that, I think is going to be the thing that's going to make the difference. And then finally, building for the future. So we have just awarded the contract for our sustainability plan, which will probably be about an 8-month venture. So the approach to our sustainability plan is, we believe at a leadership level, we have to train the leaders to really understand what it is that we're trying to achieve, but also to get that buy-in and embed that whole change management so that they can support the frontline teams. So there will be a leadership component, but where the bulk of the work is going to happen is developing frontline organization teams. So be across across multiple organizations. And the group that we have hired will be working individually with these teams to really help them understand how to do this kind of change, how to build it sustained and make it sustainable. But also then for these teams to become the champions so that this work can continue on for, I think this is the new way to do things.